Have you been diagnosed with bone on bone, arthritis, or degenerative changes in regards to your knee pain? Does your x-ray look like this? Or your MRI look like this with no space between your joint? You see, there's a knee pain continuum. First, it starts with an injury that leads to chronic knee pain. Then usually what happens is down the road you start getting or diagnosed with arthritis, degenerative changes, and over time your situation gets worse. Eventually it gets to a case of having bone on bone, and then you're looking at a knee replacement surgery when you're old enough. That is the end of the line. Well, sort of. So let's look at your options to this point. There's been prescription drugs. There's been pain-killing shots. And then you've probably been to rehab at least once. However, it's not working. At very best, you're still in pain. And the situation has really not changed all that much. So let's take a look at the current paradigm, which is pretty much just putting a band-aid on it. It's a very painful process, lots of physical therapy, shots are uncomfortable when they're taking place, prescription drugs have a lot of issues as well, so you have a costly process with very little benefit as far as pain relief regarding your knees. Quite often it takes a long time to even get the littlest of results, and there's tons of side effects like headache, tiredness, dizziness, diarrhea, nausea, insomnia, chest pain, heart rate, in regards to the prescription drugs that you're taking to address what you have going on with your knees. And then the situation usually gets worse. It's an all uphill battle at that point. Not to mention the opportunity costs. Time you're missing with your children, your family, potentially job offers that you can't take advantage of. You miss out on walking, hiking, and running, things you love doing. What about traveling? Always having to think what you're going to do and how you're going to do it when you travel? Sports you can't play anymore? How about weight gain? Not to mention your love life. In addition, you have the daily fear about taking a step, also known as limping. You're continually thinking about your knee, how you're walking, how you're stepping, how you're moving. You can't sleep at night and you're tired during the day. And basically, your life is dictated and controlled too by your knee pain. Then you have this to look forward to. Now there's some graphic images here on the next slide, so if you want to close your eyes, please do so and I'll let you know when to open them again. Your knee replacement surgery. This is where they're basically replacing the joint in your knee in an attempt to get rid of your knee pain. And after the surgery, you have to hope that there's no infection in the bone. Okay, you could look now. And you have to wonder, you have to hope that the surgeon lined up the knee correctly. The joint doesn't fail, as well as you don't outlive the joint and need another surgery down the road. And then there's the aftermath of the surgery. There's the recovery in the hospital, more prescription drugs and rehab, and there's a chance you may still be in pain. There's a much easier way though. Let's get back to the basics. What is pain? Looking at what pain is, there's nerves in your knee that are being squeezed, and this sends a signal to your brain that you have knee pain. So what's the solution? create space in the knee joint. This takes the pressure off of the nerves, and it begins to set up the conditions so your body can heal your knees. So how do you create space in your knee joint? You can do it yourself by engaging your body's own natural muscle relaxant mechanism. It's simple and easy to do, and you will begin seeing results in less than a minute. With this approach, there are no drugs, no pills, no shots, and best of all, there's no surgery. So here's your next step. I will be launching a new program in about a week. In the meantime, I want to teach you how to use your body's own built-in muscle relaxant mechanism. I've created a video that will show you how to create space in your knee. Just enter your first name and valid email address below, and I'll see you on the other side.